Hello and welcome to this edition of the Time with Hime podcast. I'm your host, Lynn Cordes, joined by our superintendent, Mr. Hime. Happy New Year.
Happy New Year. First one of 2022. If people who follow Facebook or Twitter us know, hey, I ended the 2021 with my fifth grandbaby, Hattie Lynn Hime. I'm very excited about that.
We always love seeing the new bundles of joy, especially to start out the beginning of the year and end last year. A lot of things happening. We did have a nice break, and hopefully you guys did as well. And we're back and got a lot of things to share and update with our families. One specifically is our COVID update, and we brought in a special guest to kind of help with that. So would you like to introduce her?
Yes, we brought in our health department our regional health department director, Brandie McCombs. And again, once again, we're glad to have her. She's been a regular guest.
She's going to get you because you said McCombs again.
Did I?
Yeah.
Well, I'll get it right someday. Anyway, we're glad to have you with us today. And, just what's changed? Everybody saw the new CDC guidelines, and, of course, it created a lot of confusion from the health department. And one thing we appreciate is the communication we at Lawton Public Schools have had with the Comanche County Health Department in trying to keep everything consistent. And so as we look for your guidance on how we move forward, talk to us how that's going to look with your quarantines and isolations and all those words.
Yeah, so there has been some changes with CDC, and so they changed the guidance. As we go through COVID, we're learning. We learn something new all the time. We're learning that, it doesn't necessarily you can't get necessarily infected by surfaces after a long period of time. So we learn. So now CDC has decided that isolation and quarantine guidance can be shortened just a tad bit. So isolation, if you test positive, we're going to isolate you. You need to be away from public, isolated away from public, away from your family so that you're not spreading it. If you live in a household or if you were in contact with someone who tested positive, that's when we're going to quarantine you. So that's the difference in the terminology. Isolate, you're positive. Quarantine, you're a contact to a positive. So the changes that CDC pushed out, I guess late last week that we sent out to you guys, is the time frame has shortened. So if the vaccination piece, if you're vaccinated, we're still not asking you to quarantine. So we can't stress enough that vaccines are very, very important. We now have vaccines available for 5 years of age all the way up. And so if, I get it, it's a personal decision. It's something that parents need to think about for their children. Research has shown that it's effective when we look at hospital data, when we look at death data. All of the outcomes are better for those who are vaccinated as opposed to the unvaccinated. So there's my pitch for vaccines.
Yeah, we run that pitch with you. We always talk about from the superintendent side or from Lawton Public Schools, we know it's a personal choice. Our parents can make those choices. But, again, we're far enough into this where there's been millions and hundreds of millions of vaccines given. It's proven to be safe. Like anything else, I guess there's a 1 in a billion chance that you can have a reaction of some type to it. But it's a whole lot, your odds are a lot safer. And so we encourage everyone to get vaccinated as well. And we remind our athletes and our school people and the people that want to be at work and the parents who want their kids at school, the quarantine piece you said, that hasn't changed. So a vaccinated student does not have to quarantine.
That's correct. And the caveat to all of it is if you have symptoms, we don't want you in the public.
Well, but we've talked about that, and we think we're doing a better job of that. When we first started with this pandemic, we'd have people, well, I thought it was a stomach virus. I'm like, don't bring your stomach virus up here either. Well, it was just allergies. Well, we're getting better at staying home when we're sick. We have days to stay home when we're sick. So I think we're getting better at that.
And it's important because, it's not just COVID that's going around. We certainly are having flu cases.
Yes.
And then just like you said, the stomach virus, something that we don't want to get people sick. We want to protect our hospitals best we can because at the end of the day, that's really what this is about, preventing deaths and preventing unnecessary hospitalizations.
Yeah, and some of the things people forget is I saw on the news people complaining because there are schools closing, which that's not on our radar. And again, we'll always work with our health department and different league entities and as to deciding whether we're going to close school or not. But part of the thing that would lead us to close school would be more so than the kids not being safe, not having enough adults to manage the school because we had so many adults out. You could see that more so than you ever come in and say, hey, it's not safe for kids to be at school, than us not having the adults because we got 25, 30% of our adult population home either quarantined or isolated.
Right. And when you think about LPS, your student body population is huge compared to some of the rural schools who have had to close. So when you talk about 30% of their student body is out sick, then it's easier for a school that's 200 student body as opposed to what you're dealing with.
And they can get one little group, one little clique getting into a pandemic can lead to 30% in some of your smaller schools, whereas 30% of ours is a whole lot more. Yeah. 4,200 is a whole lot more than 60.
It's a bad day if 30% of your student body.
Oh, there's a lot of issues in Lawton if we have 30% of Lawton Public Schools out with the Omicron or whatever. So continue when you look at that. What do you see with it? What are your expectations, and what do you look at moving forward?
So if we talk about Omicron, this particular variant, it's transmissible. It's much, much more easily transmitted, and so that's the concerning part. The side effects necessarily aren't as severe, so we're not seeing a huge hospitalization right now, but we're really just kind of getting into that peak of our surge from the holiday season. It's not a surprise that we're seeing an uptick in cases. I mean, we just went through New Year's, we just went through Christmas, we just went through Thanksgiving, and so all of those gatherings that people enjoyed, certainly some people may have let their guard down. We didn't wear a mask. We thought, oh, it's just a cold, oh, it's just allergies, coughing and sneezing indoors, and we can start spreading this virus. Our cases for COVID have increased, no doubt about it. We suspect they're probably going to continue to increase. But the news is that we know what to do. We know what works. We know that vaccines are important. We know that if you're sick, you need to stay home. And we know that if you're in a location where you can't social distance, wear a mask.
We are social distancing. Yes. With one thing great about modern technology, we can do this and they can put us on one little screen like we're all together, but we're definitely social distancing here in this setting.
Yes, and so at the health department, we've put that policy back in place. Our staff indoors, we're wearing masks, and we don't like wearing masks, but it's 2 years we've been wearing them, so it protects other people, and that's what's the important piece.
Now, testing. We haven't got into that a little bit. One thing we try to encourage the state, in conjunction with the state health department, the state Department of Education combined to give schools a grant amount to test. Well, one of the things we had to do was we had to try and test 10% of our student body, whereas Lawton Public Schools needs to be testing about 1,400 people a month, which is probably not going to happen. But still, we want to let people know our students and staff can be tested. You can see that on your website. You can call to get tested. And this is a conversation you and I had was, you drive by Cameron University and there's that company testing on the football parking lot and people are backed out. But I think there are other options. You might talk about some of the different things people can do to avoid that long line to get tested.
Right. And testing is important. And so your student body getting tested, because you have a rapid test, you have the option to do rapid. So that's incredibly beneficial. Someone comes in and they don't feel well, you can test them immediately, find out what their test results are. They can still use precautions, but they've tested negative, go back to the room, social distance, put a mask, and you're good. Other testing options, because Cameron is backed up. We were texting the other day talking about that. So we stood up a pod at the Coliseum. The health department stood up a pod at the Coliseum. So today, specifically, we're there offering drive-through testing at the Coliseum, rapid and PCR. But I think the thing that's really important is with the health department, we have a reservoir of resources that is not just unlimited. And so we are in a public health response. And so we are not testing individuals who, their business requires them to test once a week because they refuse to get a vaccine. That's not the population we're testing.
Correct.
We're testing the individuals who are symptomatic, who have been around someone who's symptomatic, who have been around someone who's positive, or they, went to a big event and they're concerned that they may bring it back to a school or to a high-risk hospital or a high-risk setting. We're not testing.
So the free tests at the health department are for people that are at risk. They've either been in a high-risk situation or they have symptoms. And it's a school. The tests are free. Again, both the school through the health department, because the health department gave us our tests they're free. But again, those need to be conserved because, again, we're in a pandemic, we're in a health situation for those that have symptoms. And we would encourage our parents, because it's just a signed form. Now, we don't test students without parent consent. Let's make that clear. But if your child is not feeling well and you're not sure, we'd rather you keep them home. If you just think you got to bring them to school, get a hold of your site. They should know there where they can get tested and get them tested. At least we know they've been rapid tested before you put them in the student body, because no one wants to put somebody that's spreading a disease in the student body or in any other space. So I think that works out good, the testing, and I'm glad to know you guys have opened one, and maybe when I drive by on Gore, I won't see that long line of people.
Right. Well, we're also extending hours till 6 o'clock one day a week, and then we're going to be open on the next 2 Saturdays. We'll be testing at the health
Now, is all
department.
that on your website?
It is.
In our case, you can find it on our website, where we're testing, when we're testing, because we have hours too. We have nurses dedicated to that, but we have 30 sites, so obviously our 11 or 10 or 9, how many nurses are working that day can't be testing because they have other responsibilities. In your case, it's on your Facebook page, is my understanding.
That's correct. And we push it out to all local media as well. So Facebook and local media is your best bet. And call the health department.
Yep, just call and they'll tell you when and where you can get tested. So I think that, it's a deterrent. Again, it's things that help because you don't spread it. So anything else you would like to add to the public as we, bring you in that you would like to share?
Well, I do have one that we're going to add because we've had a lot of calls yesterday. Everybody was preparing for this week and going back to school. Can you please clarify the difference between in-home positive cases versus out and just being in close contact and what that quarantine looks like? Because it is different for those that have positive cases in their house.
It is. And what we just encourage people to think about how it's spread. It's spread through respiratory droplets. So if I'm in Walmart or if we went to a Christmas party and someone tested positive and I was around them during that Christmas party, I leave and I go home. I'm not around them any longer. So my day one starts the day after that Christmas party. Ground zero is the day you were exposed. Day one starts after that exposure. And then I can start because I'm not around that person all the time. However, if I live with someone, if my child tests positive or my husband tests positive, that's different because I'm exposed ongoing every day. So your day one starts either when their infectious period is up or if that person in the home can isolate. Again, they're positive, they're isolating away from the rest of the family. That means they're not
commingling and sharing areas, bathrooms.
They are isolated away from the family. Once that occurs, that's when their day one will start. The day after is when.
We should always quarantine if we're symptomatic of, even if a cold is kind of borderline because allergies, but if you got a really bad cold, you should treat that as symptomatic and stay home as well.
And then just to clarify on that last subject that we talked about, now if they're vaccinated and the person is positive in their house, does that still change, or is that they don't have to quarantine at all, so they can come to school even if they have a positive case in their house?
Their positive case, again, needs to stay away because they're exposing them. But they're still considered vaccinated, and they need to pay attention to signs and symptoms.
Okay.
So wearing a mask would be important when they come to school, just using those precautions. But vaccines really get us a long way down the road.
And again, we have our mask policy still in place. We've probably got a little more lax on it because our numbers have been so incredible. Please start looking at it, especially if you choose not to be vaccinated, and that's where the testing comes in. If you think you've been exposed, please get a test and make sure you're clear, because my understanding, again, we're all internet doctors now because we've all become experts, but now that they're saying that you're most contagious 2 days before and 3 days after, so those 2 days before, if you haven't tested, you may be spreading it. So that's another way you can use with our free tests for our students and our staff. And obviously the health department has options, or you can get in a long line at Cameron Football Stadium and go through that.
Right. And that makes a good point. That's the reason CDC dropped the requirements from 10 days to 5 days is because of that infectious period and trying to get workforce and our communities going again. But again, right before I came here, I talked to 2 different people, 2 deaths in this community of people that people don't have to die from this virus at this point if we can get vaccines out there more.
And I also hear we still struggle with people, go get tested, with your students and stuff, because we still hear of people that, well, it's just a cold. There are options to get tested free, and the medication today is so much better than it was 6 months ago, and it's unreal the difference than it was 18 months ago. They can save you now, especially if they catch it early. They can make it a lighter case, even if you chose not to be vaccinated. So we encourage people to get tested. We encourage people to get vaccinated. Again, those are your choices. Just know there's risk with it.
All right, Brandie, thank you so much for coming. We always appreciate you taking the time out and joining us and sharing some more information. I know we're going to continue to be in contact and bring you back on later on in the year, hopefully a little later when everything is picking back up and and less about the different changes. But thank you so much.
We really enjoy that she comes on because it's informative. I think it's some of our highest viewed shows. But again, I wish we never had to invite her back.
Right. Only for good other things. Something about good positive things. Thank you again, and we appreciate it. Mr. Hime, what else can we talk about?
The one thing we want to talk about, we're back to school, weather, it's cold, things are happening, is our bad weather things. And would you explain to our public what to look for if they're not sure if we're having school? Again, in our case, remember, we'll always go virtual. Some days it'll be remote virtual. Some day it'll be a virtual where you're expected to log out today. But how our staff and teachers know and our students to know that we're not coming into the buildings those days?
That's right. So we have a team that is in contact with Fort Sill and with our Comanche County Emergency Management. So we always are looking at pending weather. If it's coming in, how it's going to impact us, we try to make the best decision, and you're again, a part of that. Yeah, but when we do make that decision, we have our notification systems.
Right. The decision is usually the superintendent makes the decision.
Correct.
Usually with some contact with the school board, because again, I am the one employee who works for the school board, so my decisions need to be based upon them understanding what we're doing, because they'll get calls on it too. The decisions to be made, close school. How do our 14,000 parents and students and our 2,400 employees know what to do?
Well, that's easy if our families make sure that they have the proper contact information on file with the school. Means correct phone number, correct email address. We will push that out first there, and then we also let our local media know, so they'll immediately put it on the news station. We can also you'll find it on our social media pages, and then we have it on our website. So we have it blasted everywhere. We like to let our families know first, if it's coming. So they'll get the notification through a text message and through our district app. So if not, you can find it on our social media pages and on the local media.
And one more thing, I'm a firm believer that kids need to be in school, in the buildings, face-to-face learning. That's a big belief of mine. But if you're at home and we're having school, face-to-face learning, and you don't feel safe where you're at or where you live to get your child to school, let your school know you're going to go virtual that day, and don't send them to school if you don't think it's safe, because we can't check every road, every bridge, or every situation.
During the inclement weather,
If it's inclement weather, yes. If during inclement weather. So if the weather's bad and for whatever reason you don't feel comfortable getting out or getting your child out to school, let us know, and we can do a virtual day for you alone.
And that means that even though they do take a virtual, they still have to complete their assignments.
Yes,
They can't just
on
be
time,
a no.
They have to log in as they go. Safety first is what I'm trying to say. We do value our parents' opinions on what is safe for their child on an inclement weather day as to whether they go to school or not.
And we work with a lot of people, so it's not a decision we make lightly.
Yes.
And sometimes we get lucky and make the right call, and sometimes there's nothing out there on the road.
Well, and one thing we strive to do with new technology is we'd rather make the call at 5 o'clock in the evening than 5 o'clock in the morning.
Correct. Absolutely. Mr. Hime, we've had a wonderful filled podcast. I don't want to keep our families anymore.
Recharged and ready to go, and let's have a great 2022.
You got it. Thank you guys for joining us. Until next time, be well, stay safe, and make positive impacts. Have a good week.